everyone, my name is Megan Lutz and I have decided to do my current event on nursing shortage. Nursing shortage is one of many problems that we face as being a nurse, not having enough nurses to staff our hospitals and units, and sometimes this can put our patients' health at risk. First, we're going to begin with what is nursing. When I think of being a nurse, I think of someone who is caring, compassionate, devoted about their job, and also putting everyone else's needs before them. I also think being a nurse is being there for people during their times of need, whether it's welcoming a newborn into the family or holding that hand of a loving one as they're taking their last breath. We're going to begin talking about rural area nursing. When you graduate, you always think, I want to work here, I want to work there. But more nurses are needed in the rural areas because nobody wants to work there because sometimes you don't have access to specialty doctors. You're kind of on your own out in the middle of nowhere per se. So that can be a huge problem when it comes to taking care of our patients. Some of the effects of just having shortage of nurses everywhere can be increase in patient safety, not having enough patients to nurses as far as making sure they don't fall out of the bed, get hurt, medication overdoses, and last but not least is fatigue due to the amount of nurses, the hours they are working. Most of them are overworked. Some of the negative effects that we have of not having enough nurses can be very stressful on the nurses that we do have. When you're a nurse, you need to pay attention to detail. It's all about making sure the right dose is given to the right patient, and etc. So with that being said, when you don't have enough nurses, you kind of become overworked and overwhelmed, and sometimes you can make these errors. And that puts the patient's health in danger because you don't know what you're doing, not because you're not a good nurse, just because you're overworked because there's not enough nurses. Patient safety is your number one goal as a nurse. Our patients is why we have a job. So making sure that they are safe, taken care of, and are on the road to recovery should always be our number one goal. As a nurse, our patient's safety should be our number one goal. When we have a shortage of nurses to cover our units, this puts our patients' health on the line and sometimes even their lives. For example, in the emergency department, if you don't have enough nurses, you are currently rushing through discharges without education on how to get the patient better. You are taking a risk of them falling, trying to get up by themselves, and so on. Next, we're going to talk about what happens to nurses when they are short-staffed. Working in an ER, I see this a lot. Your nurses get overwhelmed. They're exhausted from working overtime because they're short-staffed, and they get worn out. Being a nurse, your work environment can be very crazy and sometimes hectic and overwhelming. Most nurses work anywhere from 12 to 16 hours a shift. That means they're on their feet constantly. They are putting themselves at risk with lifting patients that are sometimes over their weight or just how they lift in general. Also, they're not eating properly, so that is putting stress on their body. Sometimes some are eating enough, and sometimes they're overeating. When you become a nurse, you can get what is called nurse fatigue. and that is more common when you work a lot of overtime. Most night nurses work 12-hour shifts, some do 7 on, 7 off, and some do 4 on and 4 off. Either way, your body is completely worn out by the time you're done. Registered nurses work very long hours, and sometimes they do not get the proper sleep, and even when they do get sleep, they are still exhausted. Last, we're going to talk about financial effects and what it can cost the institution and even nurses as yourself when you are short-staffed. When it comes to financial loss, most people don't think it can happen to them, but when you're a nurse, you take on a lot of responsibility when you care for your patients. And when something happens, even if it is your fault, sometimes those family members can sue you thinking they can get money out of you. And also the institutions, like if something happens, it can cause them loss. And if it causes them loss, then they might rely all on you and you could lose your job. It all goes back to patient safety. Patients and families can take legal actions against you, even the hospitals, if something was to happen to them or their family members. Malpractice doesn't just happen to doctors, it can also happen to nurses. So, this is why if our nurses were staffed properly, sometimes this can decrease the financial loss for institutions and even keep your job. Thank you. So with everything that I have went over with you, I hope that you take into consideration on where you choose to work as being a nurse and also some of the effects that it has being short staffed. It isn't just putting strain on the nurses, it is putting patient safety at a higher risk. Thank you all.